I'm going to start with, I guess, to give you an idea of why I am qualified to give this presentation today. I was relatively healthy growing up. I had some sore throats, so I never went to the doctor a lot. You know, and as a child, you really don't pay attention to what your parents are doing with insurance, you know. I was in college. My weight finally started scaring me. I went to the doctor. I asked her, please, you know, send me somewhere about my weight. She sent me 2 hours away. They did about $1,000 worth of blood work, said everything was normal, and sent me home. One of my complaints was my hair was thinning, along with my legs are huge. They're weeping. I'm getting inspections. You know, I was probably 500 pounds at the time. My parents always handled insurance things, so when bills came in, I just tossed them over to the side too. My mom just tossed them over to the side. We actually, I think, had 2 insurances at the time. Both my parents had insurance. So I think I finally got a phone call, and I was over 18 at the time, so they were calling me, and I finally opened one of those letters, and they had denied it. And I called and I said, well, why didn't you pay this bill? And they said, we don't cover anything cosmetic. And I was literally like on the phone going, yeah, I don't know what you think I had done, but oh, hair loss, that's cosmetic concern. So I called the doctor's office and I said, if you want paid, you need to build, you know, code this differently. I had a lot of other complaints, and it was done. After that, I was actually after that, I aged off my parents' insurance without realizing it, because my mom had given me the wrong age of which I aged off of it, and so I had to get on Medicaid, which actually was a godsend. It paid for everything I needed, unlimited physical therapy for my legs, my diagnosis, everything. Then I was able to get a job, and I thought, yes, real insurance. Joke was on me. The first thing they did was deny extra physical therapy to get me through. I had 2 weeks gap to get through the next year, and I was seeing an occupational therapist, and they wouldn't let me use my 20 physical therapy visits as occupational therapy. Then I went to get my first compression garments, and I had no DME provider who provided custom garments in my network. And so I was able to fight to get out-of-network coverage for my compression. I have won appeals against United, Cigna, Blue Cross and Blue Shield, I believe, has an asterisk next to my name, and it doesn't stand for Bramblette. And I actually, at one point, decided if you can't beat them, join them, and I worked for Humana. Now, as many of you know, I'm up against Medicare, and you know, Heather Ferguson, who is the founder and executive director of the Lymphedema Advocacy Group, which I'll discuss a little bit later, and meeting her and having a conversation with her, she said, you know, I could fight insurance, you know, all my life, or I could fix it. And I said, wow, you decided to take on Congress instead of dealing with insurance. That says a lot. I really wish I didn't have to give this presentation today because, as the previous presenter said, stress is bad for us. Dealing with insurance companies are stressful. I have a friend who insurance company sent her a bobblehead doll as a stress reliever. And I was like, are you serious? Why don't they take that money for the bobblehead and pay your claims? So with that said, here are some tips so you can try to advocate for yourself and get the care that you need and the care that you're paying for under your insurance benefits. Yeah, I'm not really making money, so. Some key words to know, because I know maybe for some this is your first time ever dealing with a major, not to say a major illness, but maybe an illness that is outside the norm. If you've had kids, a lot of insurances do the maternity stuff, no problem, you know, they don't have any questions. When they start getting some of the codes that we send in, they question them. So the first thing is your plan document. Now, when you go to open enrollment and they give you that one piece of paper with double-sided that says like, this is what your benefits are, that's a benefits summary. That's not your plan document. Your plan document's gonna be thick, several pages. So it's probably not something they're going to pass out to everyone. You're going to need to ask for it. These days, it should be available to you online somewhere. If they don't have it in a hard copy, they should be able to provide a link to you or a digital copy. And that outlines everything that your employer or however you have your insurance through, gives your plan. Don't ask other people on the internet what an insurance covers. Don't even ask a coworker what the insurance covers, because if your employer has a PPO and an HMO and a IBC XYZ plan, your coverage could be different from your coworker. So you have to know what's in your plan document. And that's where the insurance ID card too. When you have a question about your plan, call that number on your ID card. Because again, you'll get answers specifically to what plan and what coverage you have. And network. Most plans, you have a network of physicians, facilities, labs, hospitals, urgent cares. That is where you're going to get the least cost coverage. Some insurance has out-of-network benefits that you can use. It might be at a higher level of coverage, so you might have to pay more out-of-pocket for it. But again, you might also be able, if there's something called network gap coverage. So if they can't provide you, and it might vary, but if they can't provide you what you need medically necessary and what your doctor's providing, example, my garments, because there was no one in a 50-mile radius who could provide what my doctor was prescribing, they let me go out of network at in-network coverage. Now, it wasn't easy, it wasn't quick, but I joke that I have more time than money, so that's how I get things done. And these are good to know what your financial obligations are. Some people think I pay for insurance, I shouldn't have to pay anything more. The hospitals and doctors' offices will disagree with you. So copay and coinsurance. Copays is like that set amount. Every doctor's visit is $10 or $15, specialist $25. So you're gonna have to pay that every time you go, where coinsurance is usually a percentage. So you pay 20%, insurance covers 80. Deductible is usually that cost that you have to pay before anything else kicks in. Now sometimes deductibles only apply to, sometimes there's a mix on your insurance. That's why you really have to look. Doctor visits might have copays, but if you got outpatient care, it might be a co-insurance situation. So you really have to read your benefits and understand what financial obligations you have. And another thing about deductibles, sometimes you have to pay that up front when you go to an appointment, and sometimes you don't. And I've even gotten caught myself. I recently went to a doctor, planned on paying something that day. They said, no, we'll bill you. They ordered an echocardiogram. When I went back for the echocardiogram, they said, oh, we need $183. And I said, you never told me when I called to get the reminder. You never, I offered to pay you my last appointment and you didn't ask me for money. So even when you know it can happen, it can still catch you off guard. Luckily, I had the money and they didn't. I could get the appointment done that day. Out-of-pocket max, it's usually the amount of money you have to pay for the whole year. And it varies, again, all these varies. Your deductible varies, there's nothing that is across the board. One good thing about out-of-pocket max, if you meet it early in the year, then get whatever you need. I had surgery once in December that was covered at 100% because I had my PFO closed in my heart in January, so by the time December came around, I was saying, what else, give me some extra garments, what else do I want done, Continuation of care. Speaking of like December to January or whenever your insurance actually changes over, if you're in the midst, say you're in the midst of physical therapy and you find out your new insurance isn't going to cover the facility you're at, you can ask for some leeway and some few weeks of coverage under that old insurance to get you until you can see a new doctor, because you don't want that gap in care. Again though, sometimes it's a fight. It's almost always a fight. The basic principle though is insurance is a contract, and the key to navigating it is understanding the contract. Like I said, getting that plan document and reading it and trying to understand it the best you can, calling and asking for clarification. So how does this apply to what? Well, yeah, and how do I get that coverage information? Again, I said, request your certificate of coverage. You can utilize the internet for internal documents, like you can Google like United Healthcare compression garments and see what their kind of overall coverage might be. The best is to ask customer service to send you a request. Again, because of the nature of our conditions, your customer service rep that you talk to might not really know what you're asking about. You might need to have the codes of what you need covered, and I didn't add all those in because I'll be completely honest, there's so many different ones and are used in so many different ways. This could be a whole conference probably on itself about insurance and billing. So, but one thing, like I said, don't take anyone's word on it. Don't let the customer service rep say, yes, it's covered, or no, it's covered. You could call 3 different times, get 3 different answers. Ask for them to email you or send you documentation in writing. You might also ask for a case manager. Sometimes you can get them. But I don't mean to put anything down, but sometimes case managers aren't really knowledgeable of our conditions either. So there's always challenges. Okay, so now you have your plan document, you have your information. These are typically the categories that things are, that's treatment that we need falls under: the manual lymph drainage, compression pumps, compression garments, and liposuction. So, and I'm going to go over a little bit about each of them. So manual lymph drainage, you want to look for that under your physical therapy or occupational therapy. Now, ideally, you also want that therapist to be a certified lymphedema therapist and knowledgeable of treating. I know I'm using just lymphedema, but that's the term that's out there now. Your insurance plan can offer, like I said, a limited number. Sometimes they can mix it, where you get all your therapy, your respiratory, your occupational, and your physical, 60 visits total, and sometimes they limit it per type. Medicare actually doesn't have a limit on visits. It's an actual monetary cap, which I know there's also legislation trying to get that changed because it's kind of strict. The number of visits given, if needed, you can always request your insurance covers more. Your therapist would just need to put that request in to get more. And again, it's whether or not they get it. What you need to know is the wraps that the therapists use may or may not be provided with their service. They're not covered by insurance, so some clinics that I've been to provide them to patients, and some clinics I've been to expect the patients to pay out of pocket up front before you get your therapy. So be prepared that you might need to, they offer them there, but you just have to pay the clinic for them, or some actually tell you what packets to order. And again, if you have a co-payment or co-insurance, understanding that you're going to go to therapy maybe 2 or 3 times a week, you definitely want to plan for that financially before you start. So compression pumps, they are covered under your durable medical equipment benefits. There are specific criteria to qualify, and again, you can either do searches by lymphedema in the name of the company, or you can do compression pumps in the name of the company to look for them. Medicare does cover compression pumps. However, I know a lot of people have told me like, oh, they don't cover this pump or that pump. True, so that's when you might have to appeal an adverse decision and give the medical reason why you need the specific pump you need. Maybe some are too just uncomfortable for you, or some aren't the type your doctor wants. Technically, your insurance is supposed to give you what your doctor orders because insurance companies don't practice medicine. But also remember, DME also usually has a, like for Medicare, if DME covers it, you still have 20% out of pocket unless you have a supplement. So pumps can still be expensive on your cost side. Compression garments, here's my favorite topic ever. When they are covered under durable medical equipment. The coverage varies greatly under insurance right now because there's no mandate set under Medicare, which I'll get to at the last thing. So only mandate there is coverage for compression garments are for breast cancer patients, and that's under the Women's Health and Cancer Rights Act. So for upper extremities. So the insurance company can cover for lower extremities as they wish, or if they don't want to, they can make it only cancer related. Again, it varies. Medicare does not cover compression. Again, you can find information about the coverage. For people who don't have coverage for compression, the National Lymphedema Network has a Maryland Westbrook Garment Fund. As a board member, that fund is overwhelmed right now with the need in the community, and we are looking at ways to streamline the process of applications. So it's going to be a little bit before we can continue to take applications because we're trying to make it better because, again, the need is just so overwhelming in the community given the lack of adequate coverage for compression. So that takes me to the Lymphedema Treatment Act. I'm also on that board. lymphedema-treatmentact.org. It's in Congress now. Last year we ended the year with 290 co-sponsors, 261 in the House, 29 in the Senate. We just were introduced this year. We're already up to 149 in the House, 26 in the Senate. We need everyone to reach out to their members of Congress. There's a letter already on the website that makes it easy for you to just type in your address and send it. And I know I'm saying lymphedema. Let me explain this right now. Lymphedema is not specifically included in the bill because of lack of diagnosis code, lack of research that shows compression as a treatment option. But anyone with lymphedema who has lymphedema as a secondary diagnosis will be covered because that diagnosis of lymphedema will still be there. And there's language in the bill that provides the Secretary of Health and Human Services to make changes when needed. So example, when research is there that shows compression is needed for even early stage lymphedema, if that's what it shows, it doesn't take another act of Congress. So we are hopeful. There's some legislation that needs to move this year, so we're very hopeful that it will get passed. And once passed, I know you might say, well, if this is mandates a coverage of compression under Medicare, if I don't have Medicare, how does that affect me? Well, Medicare sets the standards for everyone else that they have to follow. That's where it's kind of interesting now that some insurance cover it without Medicare mandating it. But I know insurance companies have changed their coverage once they kind of realize there's not that mandate. So we definitely need everyone to, again, the letter is there. You can put your name in, you can add more to it. When I was in town, I went over to Senator Hatch and Lee's office with a local lymphedema patient to try to get them on, and that's kind of my, what I call my full-time job, is trying to get this bill passed. So when you do get denied, if you get denied, the first thing you need to know is with all the electronic billing, sometimes the denial is just a mistake in the computer, a mistake in the coding. So you might want to call the customer service number, call your doctor's office and ask them, was everything correct? What was the reason given? And your doctor can sometimes do what they call a peer-to-peer review before you actually have to initiate a full-blown appeal. But when you do get time, or when you do have to actually file an appeal, first of all, you want to know that policy. That's where we go back to knowing your plan, knowing what the coverage states. And you want to show them how you meet all those coverage criterias. Diagnosis this says I'm not drawing blank, but say maybe for custom compression, they want to know why you can't just wear it off the shelf. Well, these are the measurements for my legs, and this is why I can't. But definitely ask the reason for denial, because you don't know what you're arguing unless you know that reason. And focus on the facts of the case. I know sometimes we have a lot of emotional things, and playing with our kids is probably very important to us, but the insurance company doesn't care. They care about medical necessity. So they want to know how this is affecting your function and your medical necessity. How is it affecting the functionality of your daily life? And that is when you need to provide documentation. So any doctor's notes, sometimes pictures, anything that you think can help your case, submit it. Whenever you do submit it, you want to make sure it's tracked. You want to prove that they received it. First of all, they get a lot of information in, so you don't want to get lost in the shuffle. And you also want it tracked because there's usually a deadline. You only have like 30 or 60 or 90 days to appeal a decision. And so you want to make sure you get that in the right time frame. And keep fighting. There's actually several levels to appeals. When you get your denial, they should outline the appeals process for you for your company. And so If the initial appeal is denied, you get a second one. If that's denied, you get an external review. Usually your state's insurance commissions can help you, at least maybe give you advice on your appeal or advocate for you on your behalf, but it depends also on what type of funding your insurance is. Some insurers are self-funded through your employer. So if you're comfortable, talk to HR and let them know you are having issues dealing with the insurance company that they're paying to provide you care. And let them know that if you don't have this care, it might affect, well, I mean, you don't want to say it might affect your ability to work, but you know, employers pay for insurance because they want healthy employees who are productive. So if their insurance company is, you know, not doing the job that the insurance company is supposed to do, sometimes HR will step in and help straighten things out. But again, do that at your own comfort level and what information you want HR to have about your health situation. So again, document everything. Record, you know, keep a notebook, record the time and dates of the phone calls, who you spoke to, and a lot of times the customer service will give you a reference number for that call. Keep copies of your medical records. With a lot of the electronic medical records now, you can go in and print up your own copies if you need to send them. Make a copy when you do send an appeal. Make a copy of everything you send and keep that copy for yourself so you know what you sent them. Be sure your physician is documenting all your concerns and your complaints at every visit too. You know, maybe you have chronic pain and they just leave that, but if you've been more tired, or you've had, you know, more knee pain or issues walking since your last visit, make sure that gets documented. I'll give you an example. I was looking to have skin removed, and I had looked at my doctor's notes, and she had written like, physical exam difficult due to size. And so the next visit I said, hey, I saw where you wrote that. And I think she kind of got maybe scared that I brought it up. I said, could you add due to excess skin? And she's like, oh, sure, you know? So I wasn't asking her to do anything more, just expand on the issue. So relate the problems to your daily activities of daily living. And you can look that up and you'll see the list. It's like self-care, being able to bathe and dress yourself, being able to do housework, you know, so like walking, sitting, anything like that. When I was having issues with my arms, I took pictures of myself cooking and how my arms hang and almost touch the burners, you know, how they get stuck in a washing machine. So like try to show like pictures of how it affects just, you know, regular functioning. Like I said, so take pictures. And I put save prescription receipts. If you, I've had where the insurance company wanted to prove that I actually did the treatment my doctor recommended. So it's really nice, their trust issues. So they wanted to show, like, not that just my doctor prescribed a medication, but that I actually got it filled, which still doesn't prove that I took it, but I did. But so I would say there's probably, you're more likely to not have enough information for the insurance company. You'll rarely have too much. So make them, you know, read.